You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. With us, we have Canada's cosmetic dermatologist, Dr. Barry Lycka. Dr. Lycka, welcome to the program.
Randy, thanks for having me today. I'm delighted to be here.
Okay, all right. Now, you're well known in Canada for liposuction, minimally invasive. Also, you're the author of this book, SkinWorks. What's this book about, by the way?
You know, this book was written with a passion that I have to try and make people look younger and stay younger. It's something that I do daily in my office. It's something that we work at. And it's written for those who want to stay young, those who really want to be young.
Okay. Now, for people that don't know you, tell me a little bit about, I've had you on the program talking about liposuction, big part of your practice. But tell us a little bit about your practice. Who are the typical patients and what are the different procedures that you do?
You know, there really isn't a typical patient. We see patients from all walks of life and all different sorts of patients. But what I'd like to talk about for the next few minutes is about how we can make people look younger and the people that want to look younger. You know, you have two patients. You have a patient that's maybe 40 or 50 and she looks great. And you have another person that's 50 and looks 90. They look old. They look tired. They look like they've been around the bend. They look like they've had a tough life. Now, Randy, let me ask you a question. You're in a hiring situation. You're the boss. You're the guy that's going to hire these two people. Are you going to hire that person that looks 90 or that person that's 50 that looks 40?
Well, with all things being equal, okay, there's no doubt about it. The person that looks fresh and healthy and vibrant has an edge.
I think that's what people have to realize.
It's not even about beauty, as a matter of fact. But if they have good skin, like
if you have good skin, you look healthy. You look better. You feel better, and you act better. The world is a different world for those that really grasp it. For those that really seize the day.
Bias. You think the skin's pretty important.
You know, the skin is the largest organ of the body, but at the same time, it's the way that we go to the world. It's the way that we show ourselves to the world. Our skin has to look better. It has to look healthy, and without that way, we just don't look to our fullest. We don't take our full capabilities.
Now let's talk about, okay, so you're a board certified dermatologist. Let's talk a little bit about your background, your training, kind of where you've been and where you are now, because you're convinced, like you say, that the results you get today, and we talked at the top of the show, look years younger without surgery. You believe that?
Yes.
So let's talk about your background training.
Let's talk about my training. I trained at the University of Minnesota between the years of 1986 to 1989. You know, we were in our infancy of starting to understand exactly what was happening with the skin then. We really didn't have a lot of things. We didn't really. The first laser we had that really could make a difference with the skin was a CO2 laser, and it really wasn't very good because it would scar as well. Now we've come a long way with lasers since that day. In fact, I got a new laser recently that could really target scars and make scars better. You know, scars are something that really is something that people hate. You know, you walk away with a scar face, a scar on your face. Picture how you're perceived by the world. Picture how that really affects you.
So technology is there where you can really make a big dent.
We can make a huge difference. We can make many scars disappear, and if we can't, we can blend them in so that they don't become a part of a person's life. A person doesn't have to wear a mask anymore and hide away. They really can go out there and live differently. You know, I remember one of the first cases I saw was a young child that was bitten by a dog. She was terribly deformed by that, and I can picture her going through a life deformed like this. Well, we treated that scar and we used the most modern scientific techniques of doing so, and she now walks away without a scar. Picture how that has changed her life. Picture how she feels now. She's getting married, she'll have children.
But you couldn't do that just 10 years ago as a dermatologist?
Right now, the techniques are so much better than they were 10 years ago. They're light years away.
Okay, let's begin with the aging face, and let's just pick on 40-year-old women. Okay, so a 40-year-old woman comes in for a consult. When you look at the face, what do you see and what are some of the options?
You know, the first thing we see in a face is we start to see it starting to decay. They start to get reds and browns of the skin. And many of these women are doing themselves the biggest disservice, Randy. What they're doing is they're putting on more and more makeup to hide this. You know, it really makes them look older. And that's not what should be happening. They should be looking better. They should be looking younger. So the reds and browns are one of the things we target. We target to try to give them a youthful complexion. We try to get rid of the oiliness. We try to get rid of the sallowness. People get a yellow complexion as time goes on, which is not good. They just don't look healthy anymore.
Okay.
And we try to give them that youthful bloom back. And for the most part, we could succeed in doing that. But in addition to decay, we start seeing deflation of the skin. Everybody starts...
Like hollows under the eyes.
They hollow under their eyes. They hollow in their cheeks. And that starts looking bad.
So again, on the consult, you're looking at this one. What do they say? Do they say, what do you think I need?
You know, Randy, they come in and they say, I'm looking older and I'm not looking better. I really want to look better. So what do? We look at their jowls. We look and see how they're hanging there. We look at their skin and see where they've lost their laxity. They're getting looser in their skin. Things are starting to shift downwards. We start to look at the tones of their skin. We start to look at everything. We look at everything in relationship to everything else. I love it when a person can bring in a picture of the way they looked 20 years ago, so I can really see what's going on. It's like seeing things as a motion picture then, and we really can make the difference. We can really roll back the clock quite often. You know, we can take a person 5 to 10 years back.
Okay, a 40-year-old woman goes to you, okay?
Yes. This is the amazing thing. We can roll them back to 35 or 30, and we can keep them there.
So reds and browns at 40 start popping out. So what do you do? How does it work?
Well, let's talk about that. Reds are largely due to blood vessels. Reds are largely due to the heme in the skin. So what do we do with the reds? It's really amazing what we can do there. We can target them with a laser. The laser will make them vanish. But then we can put people on skin programs that will thicken the skin a little bit and cause more collagen to form. Things with vitamin C, things with alpha hydroxy acid in them, things that will make the skin look that much better. Okay. And that really will hold the person where they are. Now, browns, on the other hand, are a different pigment. We can't hit them with the same lasers. So what do we use? We use IPLs. We use things
What's IPL?
IPL stands for intense pulse light. It's not a laser because it uses a broader spectrum of light, so we can hit more things with it. But those browns start to vanish. We can make them go away. But then we can use creams that also make them go away. We have creams that can specifically get inside of cells and tone up that cell and make the pigment not come out in it any longer, so people can look as good as when they were 20, when they were just young, before the sun damage started coming in, before the weathering started coming in, before the aging started coming in. So we really can make a difference with those skin.
Now what about the person, though, that maybe didn't wear a lot of sunblock and they've got some sun damage or little wrinkles under the eyes, things like that?
Well, you know, that's where we have special lasers. We have some fractionated lasers. Now, in the old days, we used to have lasers that literally used to rip off the top layer of the skin. That wasn't good because people would take forever to heal. They'd take 2, 3, 4 weeks, and they'd literally have to hide away. The new lasers are what we call fractionated lasers. They take the energy and break it down into little boluses, and they put it into little pores. So we take a little energy and we literally drill a little hole, a tiny, tiny little hole that goes into the skin. Now that's like aerating your lawn, Randy. What that does is cause new collagen to form underneath. It allows us new skin to heal. And the beautiful thing about that, there is not much downtime. And we actually combine that with a treatment called PRP. PRP is platelet-rich plasma, where we take a person's own serum.
Cells in that?
There's no stem cells in it, but they call stem cells to come into the skin. And the skin then puts these stem cells there. And stem cells are primitive cells that can develop more collagen, more fibrogen, and everything in the skin that makes it look healthy. Now, the interesting thing, Randy, with this is we can also do this for scars. We can also hit a scar and make that scar vanish.
So let's explain that to me. Okay, so let's just say that you have a scar on your face. Maybe it's raised a little bit, maybe it's not. What are you doing with the technology that gets rid of it?
Basically, there's two types of scars. There's new scars, where we can rejuvenate them. We can make them go away. We can make them vanish. If you hit them in the right time frame, there's a window of opportunity to make that scar work well. Now, if it's older, if it's a scar that's been there for a long time, we have to rehabilitate it. We have to make it that much better. And what we do with that is we make it look more like the surrounding skin. We basically change that scar so it camouflages better, so it looks so much better, so it hides, and then that scar is gone.
But not through makeup. I mean, you're doing it through what? With lasers?
We're doing it through
topicals?
lasers, with topicals, with machines that just can make it vanish.
Okay, so back to the sun damage. Okay, under the eyes. Okay, I know that Canada's dermatologist is coming in today. Everyone wants to know. So the crepiness under the eyes, is that fractionated laser, CO2 laser?
Our favorite laser for the area underneath the eyes is a fractionated laser. Why? Because it can do things without much downtime. In the old days, we used to do that area. It would take off that area. It would take a good 10 days for it to heal, and it would stay red for another 3 months afterwards. So a person would have this terrible redness. With the fractionated laser combined with PRP, the amount of downtime is down to 2 days. So a person can get this done on a Friday and be back at work at Monday.
Let me get this straight. Okay, so you treat it with this fractionated laser. The laser goes in, it's laying down new collagen, and then you inject their own blood.
Yes.
That's platelet-rich plasma.
Yes.
And decreases downtime, but makes for a better result. But how so? That's the part I don't get.
You know, it's amazing because what's concentrated into those areas is platelets. And platelets have growth factors associated with them. Now, growth factors are the magic thing. They cause good cells to come in. They cause the collagen to come in. They cause the stem cells to come in. And stem cells are those primitive cells that can change into everything else.
So lasers then are the key to just keeping everything from what? Falling or keeping things tight?
Lasers are amazing tools that do all of that, and they do more. They lay down collagen. They cause the body to stay as it is. It sort of keeps it in its own time frame. They help the skin to stay young and healthy.
Okay.
Lasers help us. Fillers help us with that. Fillers, when we put them into those areas, they stay longer. See, one of the main things we're losing in the skin is not collagen, but hyaluronic acid, or HA. And that's what we're actually putting back into the skin in many of these injections. The HA basically goes in there and stays in there. And it stays longer with each injection. What I found is the first time we do it, it maybe lasts 6 months to a year, but the second time it lasts for 1 to 3 years. And the third time it even lasts longer than that.
And we're talking about fillers.
We're talking about fillers. So something magically has happened to the body. It doesn't break down as much. It stays the same way it is. It just is healthier as a result.
And Botox, we haven't even talked about Botox. I mean, is that something you do every single day? I mean, is that a
Botox
really popular procedure?
Botox is so common. It's the #1 procedure done in the world and probably will remain so forever.
Is there a technique to Botox, by the way, or is it pretty straightforward?
I wish it was so straightforward that anybody can do it, but it's not. You know, if you don't put it in properly, if you don't put it into the right muscles, people look abnormal. And all the bad Botox jokes come out because people have done bad Botox, you know.
All right.
And you see those things. I see them quite often in my office. Good thing is Botox wears off if it's done poorly, but no one wants to look like a moron for 4 months. No one wants to look crazy for 6 months. The good news is if Botox is done properly, it really delivers.
So these are affordable options for people. And what age should somebody come in to stay looking great?
I don't think there is any magic age with this, Randy. I see people as young as their 20s coming in to prevent aging. People start getting changes with aging with fine lines and wrinkles even at that age. But I see quite a few women between the ages of 30 and 50 and men between the ages of 30 and 50.
Men are coming in more and more?
Well, you know, Randy, you told me you were 47 years of age. And you know, the thing about that 47 years of age, we can make a person now look 42. We can make him look 40, and then we can keep him there for...
Do you think if I went to you, okay, now I have lighting on me, and I probably look better now than I really do in real life, but do you think you can take 5 years off, 10 years off of my appearance?
Definitely.
Knowing what you... Really?
Without a doubt, I could do that.
Is that right?
Without a doubt, I could do that. And we can make you happy. We can make you happier.
And how often would I have to go in then?
You know, everybody's a bit
every
different
6
with
months?
that. I love to see every 6 months. I love to see them every year and fine-tune things and tweak things because it's a constant process of tweaking.
Now, skin laxity, and there's so many topics. I mean, you've written this book. I've got all of the, a lot of information, but skin laxity. You say technology now allows for tightening.
Yes.
How does that work?
Let's talk about a couple of the techniques we use. First of all, when you get too lax, you fall. And there's a machine that we use for that called Alvarez, which literally lifts back the skin where it was. Before that, and what's a machine we still use a lot, is something called thermage, which is radio waves that literally goes down below the skin and literally tightens it. It literally snugs up the collagen that's in there and causes new collagen to lay down. So literally, we can tighten the skin and make a person better.
So the tightening technology, so I understand, is a radio frequency. It's heat that, what, like
It's heat that goes underneath the skin. It goes right through the skin. It looks through the skin and tightens the deeper structures.
Too technical, I mean, what's the mechanism? How are you able to tighten up jowls?
Well,
what
you know,
is it?
let me explain how Althera works. Basically,
Althera is what? The machine, the technology?
Althera is the machine that's using focused ultrasound. Now, when I used to do facelifts years ago, we used to lift off the top layer of the skin and use a little electric current right on an area of the skin called the SMAS, or the superficial muscular aponeurotic system. Now, in those days, we used to have to use the current right underneath the skin. These new machines literally go through the skin and they tighten it up without having to lift off the skin.
Is it like a shrink wrapping sort of thing?
You know, that's a great analogy. I really like that analogy. People do get shrink wrapping going, but we don't shrink it to the point that it looks bizarre. We do it to the point that they look normal.
So is jowls and neck the most common areas to do?
Jowls are the most common areas, but we also do it on the foreheads, the areas where people are drooping a little bit. So we can lift a brow from 1 to 2 millimeters just by doing this technique without surgery.
In Canada, do most dermatologists have this?
Unfortunately not. It takes a special person with a special interest, a passion for this, a person that will really look into this. You know, and again, it's very important to go to a properly trained person and a person that loves this stuff, because there's a lot of machines out there that don't work.
Okay, you like this, by the way.
I love this, Randy.
I mean, I've had you
I love this. This is something I can do day in and day out. You know, Confucius once said, if you do what you love, you never have to work a day in your life. Well, I never work. I enjoy this so much. I play all day. I see my patients and I enjoy this every day. My patients come in, they give me big hugs all the time. We spend time just talking to them about how it's affected their lives. And it's amazing how it's changed their lives.
Your book, Skinworks, where do you get it? You get it on the website? And who should read it? Is this for the clinician? Is this for the patient?
It's for the patient and the clinician. Everybody should read it, because it tells people the way things are. It tells the way things are going to be. It tells where the future is going to be.
I mean, you have all the next generation of skincare, of technology to make people look younger. You gave me a Gretzky quote on the phone.
Yes, the Gretzky quote is a great one. Wayne Gretzky was one of the greatest sports athletes of all time, one of the greatest athletes. And he said, it's not where the puck is, it's where the puck is going to be.
How does that relate to what you're doing?
The answer is, this is what we do for everybody every day. We look where the puck's going to be. We look how we can make them better, and we roll back the clock on them. And we only bring in the technology that's going to be here for 5, 10, 15 years. Technology that stood its test of time. Technology that will work, not something that people are guinea pigs and being experimented with. We are doing things in such a way that we could really make a difference.
You know, okay, so you take the 60, 70-year-old, which is very young today, but do they get the most dramatic results, the older patient?
You know, we see dramatic results in 60, 70-year-olds, but we see dramatic results in 40 and 50-year-olds. We see dramatic results in younger people as well, because, you know, these changes don't have any proclivity just for age. They have proclivity to different skin types. They have things that go on. I've seen people with brown spots on their skin in a condition called melasma, and people as young as 20.
So melasma, I mean, is there technology? Is it there yet to take care of melasma?
Absolutely. Now, we can't cure it, but we can control it and we can make it go away. There's not everything we can cure in medicine, but we can make it better.
What about darker skin types?
Darker skin types are some of my favorite types to work with.
Hispanic.
Some of my favorite types to work with, because we see dramatic differences with them. We see brown spots can make go away. And you know, in some cultures, having brown spots on the skin mean a life of perpetual sadness. So we would love to give them a life of perpetual happiness by using the techniques that currently exist.
Well, one of the things that I wanted to bring up to you, devil's advocate here, is the issue with fillers. Okay, here in California, where we're taping, I feel like I could spot the overfilled woman 20 yards away. I think it's an odd look.
You know, and I could do that too, and I do that frequently. But that's why it's so important for a person to go with an eye for this. You know, not everybody, as I say, is a Michelangelo. Not everybody is a Rembrandt. Not everybody has the eye for doing this properly. So do you agree that
some people could be overfilled?
Absolutely. I see that all the time. You look at people's lips and you see how they're overfilled. There's only one person that looks good in Angela Jolie lips, and that's Angela Jolie. You really have to have an idea what a person's going to look like afterwards and give them the way that they really should look.
So your goal is natural results?
Natural good looks
But
are
if
my
I looked
business.
at your filler patients, I wouldn't be able to spot them 20 yards
No,
away?
you wouldn't. You could go to the symphony and you'll probably say that's one of Dr. Lycka's patients because they look so good. But you would not say that that's a person that's
a woman
overfilled.
that's 40, 50, 60 with great skin, that's sexy. I mean, that looks good.
You know, the word sexy is really the important here. Sexiness is not really being a sex bomb for that matter. It's really about looking better in your skin. When a person has skin and they're 50 and they look 30, that really is sexy. When a person has skin that is 60 and they look 40, that really is
skin
sexy.
is almost prestige. You know, we talked on the phone. You said, look around. Look at the way you look at people with great skin. And it's true. You know, when a woman's in her 50s and she has great skin, there's almost a level of sophistication that goes with that.
You know, there's
perceived intelligence, or maybe
exactly. I think
I'm going too far with this.
No, but
I
skin
think so.
really is where it's happening. Skin is where people live in and everything like that. Skin, when it looks good, really gives a person a savoir-faire about them, a difference about them that really is better. And that's what we see. That's what I see when I look at it. It's what you see when you look at the skin.
All right, all right. Okay, so wrinkles with Botox, you do some fillers, you have radio frequency for tightening, right? Keep the face from falling, intense pulse light for reds and browns. What haven't we talked about?
You know, I think what we haven't talked about is putting it all together. And all this has to be put together by a qualified person, a person that's been trained well, a person that knows what they're doing, and putting this all together.
So there's an art to this. The machine doesn't do all the work.
The answer is it's a tire art.
Is that a frustrating question, by the way, when I ask you that?
You know, I wish it was a machine that could do all this for us, but really it's not. It really takes a person that has a knack and a thing for this to make it so much better.
People travel to see you. You know, you are the author of this Skin Works, but people travel to have their work done by you.
Yes.
Is that right?
You know, humbly, I have people coming to me from all over the world so that I can work on them and make them so much better. And in this day and age, the world has shrunk with air travel as it is, with the internet as it is. Everything is right there. Everything people can see. People can see these things, they know these things, and they can go wherever they want to. In this day and age, people should be choosing out the best. And I'm glad people come to me. I always like to help whomever I can.
What's your favorite age range of patients that you can help?
You know, I don't have one favorite age range, but the women between 30 and 50 are about the age range I see most of.
Who would you like to see more of? When you're out and about and you see, I mean, who would you love to see more in your office?
I think people that have some changes, that they're starting to get older, we can prevent them from getting older, and we can keep them there. I think those are the ones that I could do the best work with.
All right, and what do they say when it's all done? I mean, what are some of the your best compliments, either from the spouse, their partner, whatever? What are some of the best compliments that stick out in your mind?
You know,
you get?
One lady came in just the other day and said, "Dr. Lycka, you saved my marriage." My husband came to me and he said, "You know, I now can go out with a younger woman and I don't have to get a divorce." You know, it really was the funniest comment, but she said that. Another lady who was just starting to get the bloom off the rose was starting to get, she was a business person, and she said, "You know, you've saved my job." And she said, "You know, what happened is people weren't starting to listen to me. They weren't paying attention to me. As I started looking better and feeling better, the commanding power came back. They started to listen to what I had to say."
Interesting.
Which was a totally different scenario.
You know, there's no doubt about it that younger people are replacing older people in the workplace every single day. And people are working at a much older age. And, you know, oftentimes a tired appearance, even though the person doesn't feel tired, I mean,
it makes a huge...
It's like I had a sales rep that came in, somebody trying to sell us something here, and they looked exhausted.
Yeah. Now, wouldn't you like to have an employee that's got the maturity of a 60-year-old but looks 30? You know, the brains of a 60-year-old from all their experience, but looks the age that they're young and healthy and robust.
Yeah. Well, okay. Now, do you believe that? I want to ask you, because at the top of the show we said years younger without surgery. Do you think if somebody starts at 35, 40, and they're good with their at-home care, and they see you for lasers or IPL, how long do you think they could avoid surgical procedures altogether?
The answer is absolutely.
Really?
You know, I was trained in doing facelifts 20, 30 years ago. I have not done a facelift ever. You know, we've not needed it. Now, that's interesting, but that's been a trend I've seen in statistics. For the first time, the American Society of Cosmetic Surgeons has stated that facelifts have fallen out of the top 5 procedures. So really the trend
Interesting.
is that we don't have to do major surgery. We can do things with minor surgery. And the benefit of that is people don't look overdone. They look better, they look healthier.
Okay.
And you don't have that look where people go into the theater and they look like they've had this big facelift and they can't even smile because they're so tight. We don't get that anymore.
People always want, and we're out of time, but people always want a referral from us on wellnesshour.com. Who should I go to? And we don't recommend people, by the way. But I do say go to a specialist. And one of the things, and I want to ask you about this, that medical spas, etc., are popping up on every corner. I guess if you have a medical degree, you can buy these lasers, etc. You're a board-certified dermatologist. Do you think you have an advantage, and what should a patient look for in a place that's doing this?
I think a person really needs to look at the place they're going to, and I think every patient needs to be seen by the cosmetic doctor. They need to be the doctor that's doing the work. Even if he has assistants, the head doctor, the head honcho, needs to talk to them and see them.
Do you have a bias? Do you think the dermatologist is best suited for this?
You know, yes, I do, because
Okay.
we have a special proclivity for the skin. We understand the skin. We understand the science of it. And we understand how to make it work. So yes, I do have a bias. I really love the stuff, and I think you have to be not only a dermatologist, but you have to be a specially qualified and trained dermatologist with a passion for this.
Now, you know how, now you talked in terms of knowing how to push these machines, that you can get results maybe in a shorter period of time because of how you approach the aging face. Elaborate on that, and we are out of time. But
you know, the important thing is that the machines can be used in such a way. You know, many people can buy a violin, but they can't play the notes out of it. They can't make it into a symphony. They can't be a concert violinist. This is what I do with the machines. I push them to their maximum. I take them to their maximum, and I help people in the process of getting to their level that they should be at.
So looking great for your age.
Looking great, feeling better, looking better.
All right, I want to thank you for coming on the show. Great stuff, great info. You have some before and afters on your website, and if they want a consultation with you, they just call your office, and you'll meet with them. You meet with every consult.
I meet with every consult. That's the way I am.
Okay, good. You've been watching The Wellness. I want to thank you for coming on the show.
Thank you, Randy. It really was a pleasure being here. I really love this.
Great info. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview online, you can visit our website at wellnesshour.com. Put in Dr. Lycka's name or cosmetic dermatologist Canada. You'll find him there. And if you want to comment about this on Twitter, #The Wellness Hour. For now, I wish you good health.